get a good feeling, yeah. I get a feeling that I never had before. No, no, I get a good feeling, yeah. Oh, sometimes I get a good feeling, yeah. I get a feeling that
Rosie's now ready to get her x-ray taken. But before we get started with this, there's a few do's and don'ts. And it looks like we have a few more don'ts than we do have do's. So we're going to show you the proper way of setting up for our x-ray for our own safety as well as Rosie's. First and foremost, those open-toed shoes, not allowed in x-ray. They're not allowed in the hospital at all. We need to have closed-toed shoes, proper attire. As you can see, these two don't have any proper equipment for x-ray taking. So we need to get them gowned up and ready to go so we can get x-rays on Rosie. Now the employees are ready for their x-ray with Rosie. They have their protective equipment on. They have their thyroid protector. They have their badges, which shows any type of radiation they may be exposed to. They have their full lead gowns on, plus they have their lead gloves. Now it's time for Rosie to get her picture taken.
Can you hold this for me, please?
Sure.
Hi, Andrew. Do you have the urine sample that we were looking for before?
I just drank it.
Oh, you drank it? Oh
I mean, it smelled good.
no! What did it taste like?
It was okay.
Was it sweet? Does the animal have diabetes?
No.
Oh no!
Always wear gloves. This is how we hold animals properly. So first of all, they can't jump off the table. Second of all, they can't jump on the person holding them, and they can't get hurt. Holding them securely against her body makes them feel safe too, so they don't want to go anywhere.
Hello, I'm Dr. Mann from Boca Midtowne Animal Hospital, and today we're going to go over some lab safety features of drawing blood. This is Rosie, our volunteer. She's a pug and she's about 9 years old. She's a spayed female, and she volunteers blood all the time for blood work. And basically there are a number of safety things you have to worry about when drawing blood. One is make sure that your syringe is covered so all the sharp edges are not going to be poking anybody. We also have, once we're done with the blood draw, some safety disposal. You see the red bins at the bottom so nobody gets their fingers jammed. And then we have some of the actual tubes that the samples are going to go in. The purple tube is going to allow us to do what's called a complete blood count, which will look at her red and her white blood cell count, the platelet count, and looks for signs of infection or inflammation or blood loss. So that's a good thing to know. And then the red top is going to allow us to look at her organ function, so her liver, her kidney values, her blood sugar levels, her pancreatic function, and electrolytes. So we'll get a good idea of what's going on. And lastly, the last tube is for her urine, to make sure that she's not dehydrated, she doesn't have any urinary tract infections, and looks at kidney function as well. It looks for things like diabetes too. So first thing you do is you're going to take out the syringe, okay? The syringe already comes with a 22 gauge needle on it. And this is the part where she gets excited. We're not actually going to get a blood sample from her today because she's not due for one today. But what we would do is, safety reasons, we're going to have a technician holding her so that she's safe. And what we're going to do is apply a little bit of alcohol on her neck to sterilely prepare the area. And then what we do is just use the syringe to get into her jugular vein, which is the biggest vein here for a blood sample. We'll pull back, we'll get about 3 cc's of blood on the syringe, and then we'll place them in the tubes, and then she'll be good to go. Okay, so what we're going to talk about now is getting prepared for surgery, and this is going to be a sterile surgery. What we do is we have a sterile gown that's been opened and some sterile gloves. After I wash my hands, First thing we're going to do is grab the towel because my hands are wet and dry my hands. Each side, make sure they're nice and dry. I'm just going to drop my towel and open my sterile gown. Now that it's open, I'm going to take my gown out, making sure that it doesn't touch the floor or anything else. And as you can see, I have two sleeves on one side. On this side, I'm going to put my arms through, and I'm going to have my technician tie the back of the gown. Alright, now what I'm going to do is go ahead and head over. Well, thank you all from Lions Creek Middle School for visiting today, and we hope that you come back to Boca Midtowne Animal Hospital sometime soon.
Okay.
Hi, Fiona Pella, veterinary nurse at Boca Midtowne.
Hi, my name's Amy and I'm a customer service representative at Boca Midtowne Animal Hospital. Nice to meet you.
Hi, I'm Roberta Trollinger, veterinary nurse at Boca Midtowne Animal Hospital, and this is Rosie, the star of the video, who without her, this video would not be possible. Say bye-bye, Rosie. Say bye-bye, Rosie. Okay.
Casey, kennel care staff.
Yes, I can. Doubt, better leave. I'm running with this plan. Pull me, grab me, crabs in the bucket, can't have me. I'll be the president one day. January 1st. Oh, you like that gossip? Like you the one picking what gossip.com. Now I got a word for your tongue. How many Rolling Stones you want? Yeah, I got a brand new spirit speaking and it's done. Woke up on the side of the bed like I won. Talk like a win in my chest to that sun. G5 in the US to Taiwan. Now who can say that? I wanna play back. Mama knew I was a needle in a haystack. Oh, Valley boy, plus Maybach. I got a feeling it's a rap. ASAP.
Sometimes I get a good feeling, yeah. I get a feeling that I never had before. No, I get a good feeling, yeah. Oh, sometimes I get a good feeling, yeah. I get a feeling that I never had before. No, I get a good feeling.
The mountain top, walk on water. I got power, feel so royal. 1 second, I'ma strike for you. Diamond, platinum, no more for you. That adrenaline, never giving in. Giving up's not an option, gotta get it in. Witness, I got the heart of 20 men. No fear, go to sleep in the lion's den. That glow, that spark, that crown. You're looking at the king of the jungle now. Stronger than ever, can't hold me down. 100 miles gunning from the pitcher's mouth. Straight game face, it's game day. See me running through the crowd, feeling melee. No trick plays, I'm Bill Gates. Take a genius to understand me.
Sometimes I get a good feeling, yeah. I get a feeling that I never had before. No, I get a good feeling, yeah. Oh, sometimes I get a good feeling, yeah. I get a feeling that I never had before. No, I get a good feeling.
Gotta love the life that we live in.
Oh, sometimes I get a good feeling, yeah. I get a feeling that I never had before. No, I get a good feeling, yeah.